Here's what happens in a typical urology visit, and it very much depends on what you're here for. So, for example, you may have been referred to me by your primary care doctor for an elevation in your PSA, which stands for prostate-specific antigen, which means that we're looking for prostate cancer. So, generally speaking, you'll come in. I always like to get to know people, so I ask people what they do for a living. Are they married? Stuff like that. Sometimes people say, why do you want to know that? Because I look at you as the whole individual. So I like to know every aspect of your life. Now, in the situation of an elevated PSA, I'll do a digital rectal examination, most likely schedule the patient for a prostate biopsy, which is a procedure that's done in the office. I may schedule them for an MRI. So that's the initial visit. Now, if somebody's coming in for erectile dysfunction, totally different situation. I'll get your entire history. When did all this start? What exactly is happening? What type of treatments have you done? I'll look at any lab tests that you may have had and make some other recommendations. Usually they haven't had a testosterone level drawn. I'll do that. A bunch of other blood work. I may or may not prescribe medication or make other recommendations. So that's the kind of thing that we'll do, and very much depending on why you're here. I don't generally recommend somebody come into a urologist for a quote-unquote routine examination, provided you have a good primary care physician. So if you're at the age where you're going to be screened for prostate cancer, and that's going to depend on your family history, your genetics, your race, you may need a prostate examination and a prostate-specific antigen blood test. Now, that can generally be done by your primary care doctor. Sometimes the primary care docs don't want to do it, or patient feels uncomfortable, wants to see an expert like a urologist. No problem there at all. So that's generally what we do during a urology office visit. Now, things to come to your urologist for sure are things like erectile dysfunction, which has not been sufficiently treated, low testosterone, painful urination, blood in the urine, kidney stones, anything like that. Good reason to see a urologist. If you like this video, hit follow.